Good morning, everyone. Good morning. Welcome to the first quarterly meeting of the Healthcare Industry Consortium of 2024. I think we lost track of our quarterly meetings in 2023, so I'm just calling this the first one of 2024. We're going to go ahead and get started today because in about 1 minute, we are going to open for public comment if we have any. And then we will move to introductions from the executive leadership team. That's just a time certain agenda item. I'm waiting until 9:15, but the clock up here says 9:15. So Ronan, do we have anyone registered for public comment? Okay, well, welcome again. And I'm going to hand the microphone over to my executive leadership team to do introductions before we move through the rest of the agenda.
Great. Good morning, everyone. Marin Arriola, a governor, RGC Council, and also president of Advanced Economic Solutions. Welcome.
Hi, I'm Melissa Unger, and I am the executive director of SEIU Local 503. And Sarah, tell me what to do. I also, we have been working as an executive committee over the last, 8 months. And just recently, Becky Holtberg joined us as the president and CEO of the hospital system, the hospital and health systems. And she's been a great addition to our team and really excited to welcome her to the executive team.
Thank you so much. I'm Becky Holtberg, President and CEO of the Hospital Association of Oregon. Happy to be here. Nice to see you all in this new year.
And welcome, everyone. Dr. Bennings, the president of Portland Community College. Just glad to have you here and be able to host you in this space.
Thank you. Thank you. So I'm going to just quickly go over our agenda for today before we move to approving the meeting minutes for last meeting. So the bulk of our agenda is going to be talking about our decision-making process, and we're going to advance a decision today or move to advance a decision today. Sorry, Duncan's trying to get in the building. So, the bulk of our agenda is going to be advancing our short-term objectives, which is advising on future rounds of Workforce Ready grant funding. And we have another person probably trying to get in the building. Welcome, Duncan. And Turner Odell is going to take us through our decision-making process to seek consensus on those recommendations. And then we will move into a presentation for the Future Ready Oregon annual report. So you'll hear from our research and data director at the HEC, Amy Cox and Jennifer Purcell, who will be sharing some highlights. Welcome. And then we'll wrap up and I'll share a little bit of next steps because we'll be moving on to our medium and long-term objectives as a consortium. So that's just an overview. We'll dive into the day now. So we did that. So our first action item today is to approve the meeting minutes. So can I get a motion to approve the meeting minutes from last meeting? Thank you. Now I'm going to hand this over to Dr. Bennings, but before I do that, I just wanted to share and remind everyone that we are a public meeting body under Oregon state law. And so that means we need a quorum to advance any recommendations. So just for us and for our purposes, that's 19 members. I don't think we're going to have a problem today with a full table, but just wanted to remind everyone that we are a public body. Now I want to give it to Dr. Bennings to share a little bit more about how we're going to, or our approach to decision-making and accountability. We are going to get feedback on this approach that Dr. Bennings is going to share. And part of the process is to get feedback on that and revise our charter to get more specific about our decision-making process. And at our next meeting, I will be sharing that revised language for you all to approve and look at. So Dr. Bennings.
Thank you, Sarah. Wow. So I want to preface this with why we're all here, and the success of the consortium, the success of Oregonians, and the success in the healthcare industry is contingent upon how we work together and how we do that and how we show up in this space to achieve outcomes that will go a long way to impact regions and areas and communities across the state. And so I want to elevate in this space that we are here as a group of individuals representing different agencies, different experiences, different backgrounds, institutions, and organizations, as well as communities. But as individuals, we are here to collectively solve a problem. And we know we can't solve all the problems in the world. There's, as we wish. If there was a magic button, I'd love to press it. But we're hoping to do that together in this space. And so I want to acknowledge you as individuals in this space, having a collective role as members of the consortium, but also having a role as showing up as an individual. So we don't want to be dismissive or devalue your individual perspective and lens in this space. And so with that being said, it's how are we going to come together to continue to work together with the focus around the mission and what we're charged with doing as a group, and grounding that in the principles and the foundation of consensus. And so when you think consensus, it's like, what does it mean? But consensus can be challenging when you are in a space with people you don't know, because for me, and I'm sure for many of us, we walked in this space not knowing or having formal or deep connections in terms of relationship, but that also speaks to the power of collaboration and consensus by being able to come together in a space where you don't know folks, where you don't have those connections, and you met many for the first time. I met Becky for the first time and we connected. But it shows the power of how we can come together and do that, because we're focused on the core mission and purpose of the charge of the group. And so our proposed approach, which is there on the slide, and I can't see, I'm gonna squint on my screen, but anyway, I can't see that far. The goal is to advance consortium decisions by consensus. And to do that, we'll use consensus and evaluate proposals that continues and has, as we observe, allow for feedback and for each of you as members to voice your concerns, your perspectives, but also to inform where we may need to consider making changes or refinements to our approaches on various things. Also offering those suggestions to help just better meet all of our interests as members, right? And so if after good faith effort, if we put our best foot forward and we've held to principles of consensus, which I know Turner is going to walk us through the concept of some of that today. The ELT concludes that complete consensus is not possible if, after we've done all that we can, then consortium decisions can be made by a majority vote. Also within this proposed decision-making approach is that the ELT does recognize that this approach to decision-making by consensus is time-consuming. So we want to make the most of our time, but also ensure that it's productive and collaborative and inclusive and engaging. And so it's more time-consuming than simply voting at the outset. But we, as the ELT, believe that the value is to be gained by exploring and seeking resolution of member concerns and striving for consensus. And that includes the broader buy-in as well as the durability of the decisions to be made. It is worth the time spent collaborating to find more nuanced solutions. And so you being here and showing up to these meetings, dedicating your time to work groups and spaces outside of this and in this space really speak highly of your commitment to being a part of this process in a collaborative and inclusive way. And so that's what I want to set us up for in terms of what Turner is going to speak about. So now I'll hand it over to Turner Odell, who will walk us through the low stakes process to practice this approach. So we've been practicing it, but he's going to elevate it. Like, how does it show up? How do we continue to do it? Because as a former athlete, you got to practice so it becomes muscle memory and second nature. So Turner, I'll turn it over to you.
There we go. Thank you, Dr. Bennings. So we talked briefly about this at one of our very first meetings about using consensus building tools as a group to build upon and improve proposals with the goal optimally of reaching consensus among this very diverse and large group. So it's a big lift for sure, but there are tools that can help us move in that direction and really, get as close to, if not complete consensus on recommendations as possible. We're going to try practicing one of those tools here today, and then use it later this afternoon, or this morning, I should say, to work on reaching consensus around the recommendations for short-term funding RFAs. So you have, let me go. Perfect. Thank you. So you have a set of cards in front of you. This is a tool that we use pretty frequently. It comes in a number of different flavors. I'm kind of a fan of the red, yellow, green card approach. Sometimes you'll see it done with thumbs up, thumbs down, thumbs sideways, or 1 to 5 on fingers, but I have a hard time. It's a big group. There's a lot of fingers up. It really gets complicated. So the cards are kind of a nice visual tool for folks. So the way it works is there's a proposal on the table, and we'll go back to that in a minute, but the proposal to, in this case, for how this group wants to approach decision-making. Remembering that, as Sarah mentioned, this is an advisory group. You're giving advice to HEC, so you're not deciding things in a sense. You're deciding what advice you're going to give to them. And in this context, we'll get a chance to do that this afternoon. But right now, the decision, if you will, that you're seeking agreement around is how you're going to make decisions, which is a little circular, but hopefully that's clear. So the way it works is proposals on the table. We ask for a show of cards. If you can support the proposal, can live with it, is the way we sometimes like to phrase that. If you can live with the proposal as it's made, then you show a green card. If you have some concerns or questions, you're not really quite there, it's probably not something you would oppose, but you think there's room for improvement, then you show a yellow card. And then if you really have a problem with some aspect of that proposal, or can't really support it, or feel that you need to oppose that the way that's currently structured, then you'd show a red card. Then we go around the table and we talk with each of the folks who have a yellow or a red card up and ask, so what is your concern? And what would be your proposal to make a change that A, meets your needs, but also B, still continues to advance the interests of others around the table? That's the goal, right? Is to advance our own interests, but also to work collaboratively to advance the interests of others at the table. Does that make sense, everyone? Okay. So, I mean, I guess the only other note to make is that an additional option, if you really just doesn't matter to you how this rolls out in any particular way and on some particular proposal, you can just stand aside and not show any card, but the assumption would be that you would not be opposing that. If we don't have unanimous consensus, then we may have to go to a vote in the end, because that's the rules for this public body as it currently stands. But if you reach complete consensus around the table, all green cards or no cards, then you're good to go. Okay, with that, can we go back a slide or two?
Yes, but before we do that, I realized that we have some new folks. And as I was letting people in the door, we didn't do full group introductions. And I want to do that because we're going to be making decisions together. You should all know who each other is. So before we practice decision-making with our decision-making protocol, let's first go around the room and do just brief introductions. So name and organization. So you all know me, I'm Sarah Foster, and I am the Healthcare Industry Consortia strategist at the HEC. So Brian, and just pass the mic.
Hello, everyone. I'm Brian Beringer. I'm the executive director at the Oregon Medical Association. We represent physicians and physician assistants.
Hi, I'm Robin Moody. I'm executive director of All Smiles Community Health. We're a collaborative population health organization that provides direct services and pays for services in 300 metro area schools.
Good morning, Duncan Wise, Oregon Business Council.
I'm Janet Bitton. I'm the executive director of the Oregon Center for Nursing. We're a nonprofit that supports the nursing workforce in the state of Oregon.
Good morning. I'm Liz Rain. I am the Health Sciences Specialist at Oregon Department of Education. We support high school, career, and technical education programs.
Hi, I'm Heather Jeffress. I'm the Executive Director of the Oregon Council for Behavioral Health, which is a trade association that represents agencies or companies that provide behavioral health services. So that's substance use disorder and mental health services across the state of Oregon. We do all the things a trade association does: training, education, advocacy, lobbying, policy, et cetera, and so on. Our members employ about 8,000 to 10,000 people across the state of Oregon, serve conservatively close to over 200,000 people a year. Thank you.
Good morning. I'm Rob Winningham at Western Oregon University. I've served as our college dean, our provost, and vice president, but now I'm back teaching psychology and gerontology classes. I'm happy to be here with all of you.
Hi, I'm Neelam Gupta, she, her pronouns. I'm the Director of Clinical Supports, Integration, and Workforce at the Oregon Health Authority.
I'm Bob Dimmick. I'm the director for the Oregon Office of Rural Health. We do technical assistance to rural hospitals, clinics, EMS, communities, as well as some workforce services.
Janet Campbell, Oregon Health Leadership Council.
Hi, good morning. Rachel Kearns-Henry. I am with Governor Tina Kotek as Health and Human Services Advisor.
Good morning, Kathy Reynolds, Vice President, Talent Management, Legacy Health.
Good morning. I'm Cheryl Cohen. I'm the Workforce Development Program Manager at Pacific Source Health Plans.
Hi, everyone. Heather Stafford. I'm the Executive Director of Rogue Workforce Partnership, here representing the 9 workforce boards in Oregon Workforce Partnership.
Good morning. I'm Shankar Viswanathan. I'm with Kaiser Permanente. I'm the director for our Workforce Planning and Development Program.
Hi, I'm Nicolette Riley. I'm with the Oregon Healthcare Association that represents long-term care in Oregon.
Hi, all. I'm Becca Brownlee. I'm a program manager with Oregon Public Health Institute.
Thank you. Back to you, Turner.
All right, thank you. So just to recap, I think a couple folks came in at the end there, using these cards to help move the group towards consensus around a proposal. In this case, the proposal is how you're going to make decisions over time in the future. That decision-making and accountability, that proposed decision-making approach is here. I won't read it through because Dr. Bennings did such an excellent job of summarizing it. But at the highest level, the framework is, the goal is to advance decisions by consensus, if possible, using consensus building tools. And if that can't be possible, then to use a vote. But at that point, perhaps you'll have moved in a direction that makes it more a proposal that meets more interests than it might at the beginning. So with that, I will encourage you to take out your cards and we'll give this a try. So that's the proposal on the table. Let's go around and see where we were at. All right, I'm seeing green cards. Okay, good, we have a yellow card, thank heavens. I was getting worried there, okay. All right, so we have one yellow card, Heather. I'm going to defer that question.
Love that Heather raised. I was hoping someone was going to raise a yellow because I feel like that does need a lot of clarification. So I shared earlier on that we're a public body under Oregon law. And so we have a 36 member, Ronan, please correct me if I get these numbers wrong, 36 membership. And so majority is 19 of that 36 membership. So as we move through this process, if 19 people say yes, then that is consensus. Here. I think that's what your question is, but go ahead.
Right, to be clear, so to move any decision forward, there has to be at least 19 members of the group in support of it. So, what? Right. No, so this isn't a.
If everyone was from 19 people, no one votes red, it's moving forward.
Right, it could, although with a yellow card up, that means we should talk to Heather and find out what her concern is. Right, and right. Is not to block, correct, yeah. Yes, thank you.
And it is not, it is fairly common, but not uncommon for someone to use the I don't know what the word it was, the option to say, this is not going to help my organization, or there's not enough to my organization. But given the benefits of good as a whole, I'm going to not object to it. Now, I think that's super important because the hats while wearing the hat of the consortium, bring our individual perspectives to the consortium. But the question I have then is like, what does that vote count at? Is that like a yes vote or how do we consider that feedback when you're looking at what does a consensus look like?
So the consensus building exercise that we go through first is not the vote. So if there's not complete consensus around the table, like all green cards, literally, then we would have to have a vote. And at that point, it's the public organization rules that govern.
So I think then what I think the scenario could be, I'm holding a green card, but I'm also going to acknowledge that, I want this to move forward, even though for my own organization, I may have concerns about it.
Correct? So that's great. I mean, that's a collaborative approach. So it's perfect. The challenge here is that this is just a way for the group to work together to come closer to something that everyone can support. If you don't get there, then you have to take a vote because that's the rules right now for decision making for this public body. So if if we did this consensus exercise and some folks, I think, stand aside is what the terminology sometimes is, just says, I'm not going to block it, but I don't really care for it. Without all green cards around the table, my understanding is that we would have to go to a formal vote. And then if you don't get 19 votes in support of something, then it wouldn't move forward. You'd have to work again. Yeah. It's complicated.
It was easy at first, but with all the questions, I'm like, okay. After settle in my own mind as well. I thought, and I might be wrong, that it was, we don't have to go to a vote if 19 people raise the green card.
Yes.
Is that didn't have all green cards around the table, we then need to go to a vote and have at least 19. That's what
actually,
I'm going to clarify that if 19 people raise a green card, we would be able to say that's consensus. However, if someone's raising a yellow card, I want to hear them and I want to address their concerns. And if someone's raising a red card, I want to hear them and I want to address their concerns. And I think it's important to note, in particular in this decision, we're advancing recommendations, and the HEC is going to have final decision-making authority on what to do with those recommendations. So part of this is documenting the entire process for the HEC so that they can understand the red cards, they can understand the yellow cards, but that we as a body are advancing these specific recommendations and they take that into consideration. Moving after this meeting, we will likely maybe have different kinds of decisions that we make that maybe aren't advancing recommendations, but that's to be determined. I think we should focus this process on this decision, and then we will revisit the decision-making protocol if there are other different types of decisions that we will be making that aren't advancing recommendations. Did that clarify your question, Dr. Bennings? Yeah.
Right.
Yeah, my apologies.
Yeah. Yeah, I guess I will defer to the HEC folks on exactly when we can go from just green cards and yellow cards and when we need to have a vote, because that's really, you know, their determination of what the public body rules are for this entity.
So
And a couple hands up.
Quick public body question. So so basically the consensus is really the vote. If we've got it amongst a quorum, I think that's the important piece. So because of this is just a straight public body question. So are those votes then recorded in the minutes?
Our decision-making process here says that after a good faith effort, say we have 19 yellow cards, the executive leadership team can kind of say, which is, we're going to do this today. So this is all great questions. Going to say, oh, okay, we think we have consensus. We've addressed the yellow cards. We've had conversation with the red cards. We think we have consensus. We're going to then move to a process, and we'll have 19 people as part of that. Then we're going to move to a process and ask the question, does anyone abstain, or does anyone reject? I'm sure there's better terminology for this. Baby state employee here. And then we will record that, the abstain, and record, and if there are any abstained, we will then move to a vote and record all of the yeses. But if there are no people that abstain or no people that reject, then we will not have to do that, because the executive leadership team has determined that there are 19 people that have said yes, and then no one is then placing that red card. Yeah. Does that got it right?
Yes.
Yes, if you have documented that, and I know Phil did, so documented that he's sending a proxy, and I know that Beck is here on behalf of Emily, then yes. And if there are organizations, I think that we have OHA and a couple that have two, then I just ask that they get one card. Yes, and we have a couple folks calling in for that part. Yeah.
Which we need to check in with.
Which we'll check in with as we get. And this is, so I just want to clarify, all of this dialogue and discussion is really helpful, because what we're going to be doing is taking the feedback, clarifying this process in your charter that you will have as an updated governance document for this body.
And that we would actually
Yeah.
do a proper process on next time.
Yes.
More of a practice session until later this morning. All right. So first of all, did we address? Okay. Perfect. Okay. And then I'm going to check with Ronan to see if anyone online has a question or concern. A yellow, or effectively a yellow or a red card.
Welcome, Kurt. Do you want to share that introduction?
I'm just going to read verbatim from his introduction. I'm Kurt Toombs. I'm the Chief Executive Officer for Eastern Oregon Center for Independent Living's Institute for Disability Study and Policy. EOCIL is a global advocacy and resource center for people with disabilities. Our center provides direct peer-based services to 13 Eastern Oregon counties. We have offices located in Ontario, Burns, LeGrand, Pendleton, and the Dalles.
Thank you, Ronan.
All right, so let's do it one more time. This is the way it works. We go grab your cards, show green, yellow, or red card, depending on where you're at with respect to this proposal, which has not changed. Around green cards. We got some thumbs in lieu of green. That works too. All right, not seeing any other colors. So we are all green. So we're all in support of this a proposed decision-making approach.
Thank you. Thank you for entertaining that. It's always good. I love Dr. Benning's athlete references. It's always good to practice. Before it's always good to practice before you get to the actual race. And my clicker has stopped working. There we go. Okay, so now we are going to actually do the thing. So before we do the thing, I just want to tee up the short-term objectives of the consortia, which were to advance recommendations on future rounds of Workforce Ready grant funding. And I'm going to share a little bit before I introduce two of the work group members to walk you through the recommendations. I'm going to share a little bit about our process. So after our last meeting in September, I invited anyone that was a consortium member to participate in this working group. And our work group charge, we held 3 meetings, was to inform round 3 requests for applications. And the total available for healthcare that we had to work with was 18 million. These are ARPA dollars, and they need to be obligated, which means in contract with the grantee by December 2024 and spent by December 2026. The kind of advice that we worked through was the number of RFAs and funding amounts for each RFA. So we have 18 million, but we can decide to run several RFAs. The focus of the RFAs, and then additional criteria that we'd want to include in that RFA. So that was our charge. And so here's a little bit about our process is once the working, I'll go through the membership in a second, but our first meeting in October, we developed kind of a set of guiding principles that we wanted to use to guide our process. And I grounded the group in charge and recommendation parameters. And we also looked at some analysis around the funded and unfunded proposals generally. What kinds of proposals were funded, what kinds of proposals weren't. We didn't look at specific organizations, but we were able to look at aggregate information about the funded and unfunded proposals in the first 2 rounds. In November, we reviewed the funding landscape, which we'll get into in a guiding principle to ensure this wasn't duplicative. This was adding value to the ecosystem of investments. We advanced some initial recommendations. Then in January, we finalized the recommendations, the funding amounts for each, and some additional criteria. And now we're here. We're here to finalize the recommendations. You've seen the 2-pager I sent out with the meeting materials that highlights this process and recommendations. And now I'm going to introduce my colleagues. 2 of them were on the funding working group, but here is our work group membership, which included Marin Areola, Neelam Gupta from the Health Authority, Becky from the Hospital Association, Dave Kohler from Rogue Community College, Sarah Lochner from the Coalition of Local Public Health Officials, Christina Peters from the Northwest Area Indian Health Board, Liz Rain from ODE, and then Kyle Stevens from Southern Oregon Workforce Investment Board. I know some of you maybe have signed up but weren't able to attend meetings, so I just shared the folks that had attended at least one of the work group meetings here. So I thought it was a nice mix of community-based organizations, workforce boards, industry representatives, state agency leaders who are also investing in healthcare workforce, and others. So I'm going to hand it over to Becky and Marin to go through the recommendations.
Thanks, Sarah. So I'm going to talk a little bit more about the process. It was, I think, a very thoughtful process of arriving at these recommendations. And there was not always agreement initially on what we should do. So I think we hadn't necessarily been trained in our green, red, and yellow cards, but we had to use those principles in arriving at these recommendations. So I'm saying that to say, I think there are going to be things that you can all agree with, and maybe some things you disagree with in these, and that's okay. So when the work group initially convened, it was important to ground ourselves in the landscape of what has already happened. And so that was, as Sarah said, the first work is what what has happened in the first rounds of funding. And also we talked a lot about what else has happened in the legislature and other places around workforce funding. After we looked at that, we asked ourselves a couple of questions. What's in the data? What does the data tell us about what the needs are? How can we capture momentum? There were a lot of proposals that were unfunded, and how do we capture the momentum of those proposals and build on them? How can the investment support specific industry identified needs within the goals of Future Ready Oregon? And then that discussion led to the development of this set of guiding principles. I'm going to very briefly walk through them, but not get into a lot of detail. The first guiding principle was that funding should balance program scale and equity. We want to scale existing programs because that is an efficient and a rapid way to advance workforce training. But we also want to recognize that one of the foundational principles of Future Ready Oregon is equity. So we want to make sure that we are focusing on equity as well. So balancing those two things. Funding should seek to address occupations with the largest workforce shortages across the state, but also allow for the elevation of local needs because needs are different in different parts of the state. It should seek to fill funding gaps and not duplicate other funding sources. There was a lot of conversation around this principle because there has been a lot of effort in the workforce space in different areas. Funding should incentivize and resource partnerships between education and training providers, employers, and community-based organizations. Don't need to really say more about that. And then if funding is directed to short-term credentialed, non-licensed occupations, these are often more of the entry-level jobs, it should also prioritize retention and career advancement strategies that create higher wage opportunities for priority populations. So we want to bring people in, we want to create opportunities for them to advance. That's not only good for the people we're trying to serve, but it is helpful for developing that workforce pipeline of the future. And then funding should address barriers for priority populations, for example, wraparound supports like childcare or tuition support. So, that is a long list of things that we want to try to, of principles that we want to try to apply to these recommendations. So I'm going to, I think, give a quick summary of the recommendations, and then I will turn it over to my colleague to go over in depth the recommendations that we suggested. So during at the November and January meetings, we kind of synthesized around these concepts. The HEC should run 2 RFAs specific to the healthcare sector. The 2 RFAs should split the 18 million equally. 1 RFA should focus on nursing career pathways. I think you'll hear more about what that means. And then 1 RFA should remain flexible to meet community identified workforce needs. And so again, trying to balance regional needs with broader statewide needs. So with that, Marin, I will turn.
Thank you, Becky. So moving forward on that. So basically 2 RFAs were created or recommended. 1, focus on nursing career pathways, which means how do we consider workforce occupations related to nursing? And of course, we talked about CNAs too, MAs, LPNs, and RN, but also to focus on, home care workers and so forth. And then also to make sure that there's balanced partnerships across employer, community, long-term care, and community-based care. That was really important. Collaboration, partnership. And then also to establish programs or programs that are already established are ready to scale. Also to look at what's out there in the community, what's being done in the industry, and then maybe support that to further enhance that program that people are already doing out there in the community. So definitely in terms of summary, focus on expanding education, training, job placement, career advancement for the broad nursing career pathways. And again, you see the sectors there that we sort of mentioned that we want to target. So for that, we are recommending $9 million allocated to that specific RFA. The other RFA, which is number 2, focus more on innovation and regional partnerships. And that was also $9 million in terms of funding allocated for this RFA. Innovation meaning looking for projects or programs that maybe are not out there in the community, maybe new ideas, new concepts, new ways of doing things. That was really important, for the committee, and definitely partnerships. I think going back to Future Ready Oregon, collaboration was really, really key with employers, community-based organizations, educational institutions, and so forth, but in a way that it's real and intentional, not just tokenism, but in a way that's really integrated within the proposal or their program that people would develop. And definitely focus on regional partnerships in terms of parts throughout the state, maybe like Eastern Oregon, Southern Oregon, the Willamette Valley. What can be done within those areas? So regional partnerships are really, really important. And then, of course, focus on culture-specific responsive education and training. That was really, really important. And back to Future Ready Oregon, in terms of the bill, culture competency, culture specifically was really key in the work of Future Ready Oregon. And then definitely making sure that proposals, again, really dictate and really address the innovation as part of the proposal, part of the program. So here we're looking at, for example, projects can include behavioral health, traditional health workers, but also other areas. So we want people to innovate, to think outside the box and look at what can they do with this $9 million in terms of innovative regional projects. And again, this is really important because we do want innovation. People to think outside the box and focus on workforce development. And we're hoping that with this funding, people can really create and innovate new things that haven't been done before. So that was really important. Thank you. Sarah?
Thank you, Becky and Marin. And so we're a little ahead of time, but I think that the consensus process might lead to a longer discussion. So before we take just a short break, I'm going to ask the group for clarifying questions. We're going to lead a big discussion, but I want folks to really be rooted in these two recommendations, these two bigger recommendations, before we move to that. So any clarifying questions on the process, the guiding principles, and then the recommendations? Yep. Mm-hmm. Correct. It could be both. The second RFA could include innovation, or it could innovate off of an existing program. Becky, go ahead.
The way I think we were thinking about it is there was this one that was nursing career pathways, which is the entire continuum. So it's like things you might not even, like medical assistance, you might not consider part of a nursing pathway. But then the second was more, what are locally identified needs? We talked about other things we could fund, like specific sectors we could fund, but it was hard. There was really no consensus on that. And what there was consensus on is that in different parts of the state, needs are different. And so we wanted to recognize that there may be, and have one RFA that allowed that, that I think allowed that flexibility to meet local needs. It was less about innovative partnerships, although that was a part of it, but it was more about like the ability to have regional specific needs addressed.
I just have a question about, like, is the idea that what if one person thinks it fits into both categories? Can they just apply? Like, is it going to be really specific to pots of money? Because I do think there's going to be programs that fit into both. And so I guess I'm just trying to figure out how that works.
Oof, that might be a Jennifer Purcell question, but I think that the idea would be that if you were going to, and so the nursing, as Becky said, is very broad, and I'm going to interpret what I understand the working group because I was the facilitator, so I want to be careful about that. Interpret what I heard from the working group is that both to address the scale question too, is that if you're an established program and you want to recruit, say, home health care workers into the nursing career pathway that was identified as a huge need, that would fit into the nursing. So if you are going to have a nursing focus at all, that you would be able to apply there. But I could see the question, and I think that I'd be curious to hear from Jennifer how she would respond if there was a regional nursing program. Yeah.
Yeah, I can affirm that they will have to be separate and distinct applications. If they wanted to be considered in both buckets, they would have to submit separate applications.
But then would the same people be able to decide, like, is it gonna be one kind of like,
Evaluation
one
process?
that you'll be like, okay, this fits better here, or it fits better there, or is it the same group of people who will be looking at the two different buckets?
I think we would look to this group for recommendations about evaluation process and how we might consider each of the buckets. But structurally, sort of operationally, they would have to be separate applications. Is that helpful? Okay.
Duncan and then Jana. I've seen Duncan's hand up for a while.
Thanks. On the first one, which I see as a really targeted opportunity, but I guess it really relates to Melissa's question. I mean, are you looking for innovation in building new models in that as opposed to existing programs? And if it's existing programs, how do we sustain them? If we're scaling them up, this is one-time money. So I mean, maybe this is a larger conversation later, but I'm just curious how you thought about that.
I would agree with Duncan. I think the thing that's missing here is a sustainability component. It's not just it's innovative, but is it innovative, scalable, and sustainable? I think are two words that would need to be included. And I'd be curious, and I know you brought it up, Jennifer, like what's the evaluation process? So it's you've called out the groups, but I'd love to know how they're going to get evaluated.
You know, I'm sorry. Quick comment. I'm assuming our job is not to get into the weeds of the grant making process because we want to avoid that conflict. Is that correct?
So I do want to share that we really tried to keep these recommendations high level so that folks weren't locked out of applying. So, you know, and so we couldn't develop specific questions. We couldn't develop specific evaluation criteria because if we really wanted the expertise of folks on the ground to be part of this process, and that would limit their ability to engage in the process, and we wanted their expertise. To answer, I think your question, Duncan, around innovation. So all of this is run through Future Ready Oregon guiding principles and our framework, which includes innovation across the board. I think that in the nursing, so that's included in the nursing pathway. I just think that that's why I just wanted to say it's all going to run through Future Ready Oregon guiding principles aren't going to get lost. The conversation, as I remember, and Becky and Marin, correct me if I'm wrong, around scaling existing programs was the one-time money and the timeline being pretty short. We have 2 years. So once this RFA gets launched in March, said that out loud, Jennifer. Once this RFA gets launched and things are in contract, people have 2 years to spend it max. And that's really hard to stand up a nursing program from zero. So in that bucket, we were really looking at existing infrastructure, not necessarily an existing nursing program. As I mentioned, like recruiting home healthcare workers into the nursing pathway could be an innovation in that nursing bucket, is how I understood the discussion at the funding working group to be. But we really tried to stay away from too in the weeds so that we didn't lock people out from applying. And I have a couple, but Jennifer might have
I just want to, is that on? I just want to add one clarification on this question about innovation and how we think about innovation based on the guiding principles of Future Ready Oregon. And it really is grounded in the information that we presented at the last meeting around foundational criteria, which are the partnerships, coupling education and training with wraparound supports. That's how we're defining innovation, as opposed to, I don't want that to be seen as in conflict with the idea of standing up something new given the recommendations you all are considering today. So I just wanted to add that clarification.
Thanks, Jennifer. And I just wanted to check with the funding working group to make sure I captured that scale conversation correctly. Okay, thank you. So I have Jana.
No, I just wanted to add something.
Okay.
So there was, I think for me, it's not necessarily about being in the weeds, but as much as just acknowledging that part of the process is to where will those questions about sustainability be captured, right? If it's not included here, I don't think asking for is it innovative and sustainable is too much in the weeds as part of the criteria. And then I think the other one is where, at what point do people get a peek into the evaluation process? Don't have to talk about it today, but I would be curious about that.
That's great. Thanks, Janet. Jana.
One thing that I want to ask the committee that put together this and also the guiding principles. I noticed that this particular round of funding needs to be committed by the end of this year and be spent completely by 2026. And the data that we have is showing that in Oregon, at least, and actually throughout the United States, there's an issue of retaining and retention and keeping people in the workforce that's actually just as emergent as recruiting. And this seems very recruitment focused. So was there some discussion about room in this proposal for either of these proposals, nursing or other pathways? Is there room in that proposal for innovative retention strategies as opposed to just specifically the pathways?
In the application process, based on the recommendations, say they're accepted, that's where some of those questions will be answered. Like, what are your plans for, and possibly we can make recommendations, suggestions on things that could inform that part of the process. But that's something that I would see being included there. It's a very great question though. Yeah.
And my recollection is we had a long conversation about retention, a really long conversation about retention. I forget what month, and because there are a lot of months, and a lot of the discussion was around career advancement as a retention strategy. And so yes, you can apply and do retention in the nursing pathway in this application. That is absolutely included. But we weighed, as we could have run an RFA or recommended running an RFA just specific to retention. We felt like that was limiting. And so the whole nursing career pathway, which includes retention. So as I'm thinking about notes, potentially highlighting retention in there. Yeah. Cheryl.
Yeah,
And I have
I
two
think
here.
first, I just wanted to thank everybody who was a part of this work group for being so thoughtful. And then the clarifying question is I'm looking at kind of the timeline, and while this group was meeting was when round 2 was announced. And I'm wondering if someone who is a part of this group could just kind of summarize how round 2 informed these recommendations. Because I was really struck by how many people applied and how the need is great and the money is few. So just trying to get a sense of how round 2 informed these recommendations.
I will do my best and then look at my work group members to respond. As what I think I shared in the process slide is in October. I was able to present an analysis on round 2 funded and unfunded proposals. So at an aggregate. So of course, we did not share any identifying information about those proposals, but the analysis included what was funded and what occupation, like education and training occupations, if they were education and training focused, or if they were career advancement focused or upskilling focused. Also looked at the amount of money that we funded and looked at the unmet need. And I think Becky shared in her presentation was that one of the first questions we asked was, do we capture momentum in the unfunded proposals, or do we move into other things? So I will just share in that analysis, most of the unfunded proposals were the education and training expansion or education and training pathway, there were very few retention incumbent worker training programs, very few upskilling. There was just very few folks that applied. And so I think that when we'll get to the final thing, I think this is a huge role of the consortium. If that is what you want to see, it is a competitive process. But if that is what you want to see in the applicant pool, then I think it's a role that we can play to make sure that there's a diverse applicant pool that includes more retention focused proposals. Then it will run through the HEC process. But that's how we considered it, as we looked at the occupations that were funded. We looked at the occupations that weren't funded, and we started to make choices from there based on our set of guiding principles. That's good. And that's where yeah. And I think just our work as a consortia to make sure that folks are applying with those types of projects. So Becca, I have skipped you twice. I'm sorry. So you are first.
It's quite all right. I just wanted to clarify and make more explicit the link between the guiding principles of the largest workforce shortages identified in the data and the nursing. I'm assuming, just to make that link really clear, that means nursing is what the data indicates is the biggest gap. Okay. Just wanted to make sure I was like really there. And then similarly with the flexible, the second or application for number 2, behavioral health and traditional health workers, is that also in the data, or is that, I see it also calls out kind of the regional identified workforce needs. So I wasn't sure if that was more the qualitative or quantitative side.
So to clarify, the statewide data shows nursing across the board is the largest shortage. And so from there, though, behavioral health, mental health providers is also in the shortage. I'm not going to argue against that. It's hard to get to the very specific occupation level data. And those were 2 examples. So we're not saying that, we just wanted to make sure that folks, because we talked a lot about behavioral health workforce and traditional health workers, as you can imagine, in our funding working group. And we felt like we didn't want to, because dental assistants are important across the state too, and other types of occupations. So those were just 2 examples that I highlighted. Does that clarify? Okay. Nicolette, and then, do you have a clue? It's only because people on Zoom can't hear.
Yeah, I think I just wanted to add that one of the reasons you see nursing career pathways and this other regional approach is that the data clearly shows the biggest gap is in nursing and nursing related professions. So I'm including CNAs, MAs, those professions. So that's why one RFA is very targeted to nursing and nursing pathways. On the other RFA, there was not a consensus in the group of what of a particular sector to target, like behavioral health or community health workers or techs. And so that's why that second one is designed with the flexibility to meet locally identified needs, because what is needed in Southern Oregon may be very different than what's needed in the metro area or in Pendleton. And so I think that was the way you're seeing one focused on nursing, clearly based on the data, and the other one more broadly constructed is to kind of be able to do both things, address the highest need, and on the other hand, try to meet those regionally identified needs.
And then I just have a question, just kind of simple math. If there's 18 million in this round, I'm assuming these dollars are split evenly. I know you mentioned the first one's 9 million, so I'm assuming there's
it's evenly split. Yeah.
Okay. And then the other question I have is under the RFA for number 1 on the nursing career pathways, and looking at credentialed positions like the CNA 1, CNA 2, I wonder if we need to not take pause, but just be aware that currently OSBN is in the process of potentially consolidating the CNA 1 and CNA 2, and what impact that might have on looking at different RFAs in March that might be specifically geared towards a CNA 1 or a CNA 2.
I appreciate that comment. Heather.
I just want to compliment the working group. This is what felt like an impossible task to make sense of it. Like this is of all industries, healthcare is very diverse and the need is great and the impact is huge. So I really like this. I suppose I heard something about the evaluation process. I just want to turn into a more formal recommendation that if we're going to split the money into two distinct RFAs, it could maybe unintentionally benefit those more professional organizations that have more professional grant writers that apply for both. So my recommendation is have some oversight, some body that oversees both so that, maybe there's benefit to that. But, if you want innovation, sometimes your grants applications aren't going to be the same caliber as some others. So I know grant making is difficult, but that's my recommendation.
Sure that they're working CBOs and other organizations that don't have the support or the funding or the resources to have grant makers do that full time. So that's I think an issue that would definitely people would kind of look at. Yes.
So I think with Heather's comment that started to move into like making a change. So we're going to move actually into our formal discussion now. I wanted to just make the clarifying questions were great, but I think now is the opportunity for Turner to lead us through the consensus seeking process and where some of those more formal recommendations can be elevated. I think we should just move forward. I'm going to turn it over to you, Turner.
Okay. All right. Well, assuming then that we've gone through the clarifying questions, now's the time we get to do the red, yellow, green card exercise again. So the proposal is unmodified at the moment. Is there one slide that kind of summarizes the?
No, but you have we aren't in a break. You have all the recommendations laid out in your folder.
So based on the recommendations as laid out on the papers you already have, let's go around the room and show a card, green, yellow, or red. Where are we at? All right. Okay, we've got a couple three yellows here, 4 yellows. We've got some yellows around the room. So we've got some questions to answer and maybe some tweaks to make. So I'll just go around and try to pick up all the yellow cards.
Who had a yellow card up?
Yes.
Okay, we're going to start here and go around.
I think the nursing career. Yeah, the nursing career one, just, based on the data we've seen, it definitely makes a lot of sense. My concern about the second one echoes a little bit what Heather mentioned, which is I do think that it will tip toward the haves, which in dental, we don't have like large dedicated, workforce entities the way some other groups do. So I'm just a little concerned, I guess, just again, thinking about that broader issue of dental and the fact that there isn't licensure for dental assistants, which was also shown to be, one of the larger workforce needs out there, that just, it'll be hard for our colleagues to access money.
So part of our obligation as yellow or red card holders is to make a specific suggestion to modify if you have one or not.
That maybe instead of like partnerships, you might be able to look at like large organizations, businesses. Think about a Willamette Dental with, clinics all over the state if they wanted to, kind of run something on their own. So.
So I want to clarify that part of the workforce ready grant funding criteria is that private businesses can't apply. So that, okay. Well, we can't change that's statutory. So there are certain things that are statutory where a partnership wouldn't, so those are our limitations. Thank you, Duncan.
Thanks. First of all, I think it's a great proposal, so thanks for all the great work. On the nursing, I guess I hope we can use that report we got at the very beginning, longitudinal data. I would love to include that in the RFA in some way to say, because that really did highlight all the major barriers. I thought it was a brilliant report. And if we use that to say, we're looking for ways to fix this pipeline with whether it's current practices or innovative new practices, like retention, because retention, I remember clearly, was a huge issue in the talent pipeline report. But if we could, I mean, to me, what we're trying to do with this investment in particular is to figure out what the barriers are and find innovative solutions. So I really like this focus, and if we can find grants that would support that improvement of the pipeline, I think that'd be really great. And then I'm very enthusiastic about this.
So I want to make sure I'm capturing that to hear it correctly, is that just making sure we're identifying system barriers. Was that okay?
So not necessarily.
And I would love to see that report go out so people can read it. Because it gives a really good and people need to think about it. They really identify the challenges. And I think then people could respond in a more strategic way with their applications.
Okay.
So
That's
can the
helpful.
RFA reference that report? Is that
Just make it, yes.
And are we allowed to do that? Okay. Okay.
I think the only thing that is holding me back from being a full green is because of the piece about retention and the discussion about pathways. So I just wanted to make sure that we really talk. I really am hoping that as part of the criteria that we are extremely intentional to make sure that we talk about the retention, especially when we're talking about something that needs to be done in the next 2 years.
Thank you. Other yellow cards.
Hi. So yeah, again, really appreciate this. And I'm probably, my concern reiterates what some other folks have said here. One, I love that you put it in 2 sections. Of course I do, because I'm behavioral health. But we actually, there was an immense nursing need in behavioral health also. So I really appreciate that. People don't always realize that, but it is true. From the CNA all the way through higher levels of nursing. So thank you for that. And I just ask that we continue to attend to that, and that there is a wall between those two. Because I do think in the second bucket, you get into opportunities for other diverse professionals to apply. And then I wanted to reflect back. I think that this work that the committee did really is reflective of some of the conversations we've had over the last, year, last year. And I really concur with Duncan that I think we had an ask before about many of the projects that have been funded are really exciting opportunities to capture systemic barriers and people's attempts to create sustainability alternatives to these systemic barriers. And I would ask that we continue to do that, and that be part of the consideration in the process, because I always have worries with these one-time kind of funding that we're just encouraging grant hopping and not addressing systemic barriers. So I really feel that that's, we've had that conversation in this group a lot, and I just hope that we continue to have that conversation. And I think we have data coming out of these projects that would be very useful to policymakers and decision makers about where the gaps really are, and that we'll have data from these programs and continue, especially with the way you've divided this. I think we'll have even more. So I guess that's my suggestion, and also just kind of capturing some of the things that we talked about.
What was the suggestion specifically?
So I guess my suggestion is that the committee or the evaluation or the infrastructure of the HEC really take time to analyze what are the common barriers and why are people requesting this funds, because people are requesting funds to support things that otherwise they have not been able to sustain, right? Most of the time, either because it's innovative and there isn't money for that, or because maybe it's innovative because it hasn't been able to be sustained, which is another form of innovation. And how are we going to think about that's a systemic problem? I could give you many examples in behavioral health, and I'm sure that nursing could also give you many examples of that we have long-standing gaps that need a larger decision-making body or policy or decision around systemic structure, particularly for lifting up culturally specific services and engaging that workforce is one big example that I can talk about. But I think we've made some strides. So that's my recommendation, that we actually internalize not only I like the way the granting structure is, but that I ask that the HEC really take a look at who's been funded, how successful was it? Did they come up with an innovation that allowed some kind of systemic recommendation change to happen, right? That we really give the HEC some ability to really take a look at that and come back with recommendations based on the data that has been discovered through these 3 granting processes. Does that make sense?
So it's really a follow-up to this
Yeah,
process as a
yeah.
whole,
I
not
think
so much a change
yeah.
in this RFA. But
Yeah, but I
what you
do say I really do appreciate the division of labor here, and I hope that that doesn't get mushy on the division of the nursing and the other. Yeah.
Thank you. So other yellow, you were green. We have a yellow over here.
Heather said it eloquently. I still emphasize my recommendation on bullet number 3 in the criteria of number 2 should say how the project is innovative and sustainable. I think the idea of just having projects that don't go anywhere is a problem. I think we need to really evaluate how sustainable and scalable is whatever we're funding. The other one is we talk about data informed number 1, and I wonder why data cannot inform number 2. So curious how number 2, the evaluation process does not take into account data. So I think that there's data out there, whether it's not as solid, to really inform where the pain points are. And I think this is where a lot of the rural communities may be disenfranchised, because people who might have more influence or a louder voice might be able to champion something. So it would be good. This is not about changing the RFA as much as saying now in your evaluation process, how is it data informed, and how are we looking at a weighted process to make sure the rural areas and maybe other smaller entities are not disenfranchised through this.
I appreciate that. And to respond directly just to the data piece, in the RFA, that will be the first is like, why do you think this is a need, and what data do you have to show this is a need? So that has been in the last 2 RFAs. We just didn't want to pick for the community in that area. We wanted them. Yeah. And I think that Heather and your comments around sustainability can be elevated in a criteria. You have a yellow.
This is more around enabling. This is a little bit to the retention piece, but also about the success of entry into healthcare or entry into nursing careers. We're seeing a rapid departure of seasoned, experienced nurses who are critical for both the education and the precepting of new nurses so that they can be successful. And so I want to make sure that especially in the nursing career pathways piece, that there's language that enables programs that support the experienced nurses remaining and being around to support the new nurses.
Yes, and I think that gets some of the longitudinal data collaborative recommendations. So absolutely.
Is that, so I'm tracking specific proposals to alter the, so how would I?
Would you say that altered the recommendations, or just did that build off of, I think, some of the OLDC recommendations and nursing retention? Because I know in their
What I've just said doesn't sound like it. I don't know.
Sure.
So the way I was tracking the earlier comments was to include explicit reference to retention as part of number 1. And this sounds in that same vein.
Preceptor retention, yes, for preceptor retention, and also transition to practice for experience.
Okay, that's a bigger, it's a retention with some language around it.
Okay.
Yeah. Yeah. It's the. Yep. Yeah. Yes.
So yes, it's retention, and it's also ensuring that the program allows for programs that either are focused on retention of experienced nurses, or it supports experienced nurses being leveraged to retain and grow new nurses.
Thank you. You have a yellow.
I do. And my input and recommendation is related to what Kathy and Jana and Duncan have said around adding language around retention, but also want to make sure for the OLDC that we're calling out that we have major retention problems, in particular for BIPOC nurses. And that looks different from nurses from dominant cultures. And so I think what was all just said, but for priority populations, which is part of Future Ready Oregon. So I would hope that we're also talking about adding an additional criteria around retention, like a different bullet point that's specific to retention. And I don't know if we want to name that it's specific to priority populations, but I think that that's important. It's not just experienced nurses or new nurses or all those different types of nurses, but we're aiming to diversify the workforce.
Yes, and it is all priority populations, so that that doesn't go away. And I think what I was trying to avoid is layering all of Future Ready Oregon's guiding principles over some additional criteria for you to work through. So that is definitely already in there. So if it yes. Yeah. Absolutely. Yeah, sorry. Yeah, here, why don't we do, or maybe Todd, can I have your microphone? And I think that here, are you done?
I'm done.
I think that from my understanding of reading the OLDC report frequently is that there were no specific recommendations for that additional study needed to be done around how, what are the retention strategies. So I just want to name that there weren't specific recommendations. It's not.
I was not a yellow card, but I do think on this retention piece, we also just have to acknowledge, I mean, Becky and I were just talking about it too, is employers they can't apply for this. Employers have a huge role in retention. And if an outside group, they have to be working with an employer to make it work. So even if you're trying to do mentoring or mental health, we do a mentoring program through our CNA apprenticeship. And it's really difficult because unless the employer is giving time off, then you're asking the person to get additional time to talk to their mentor when they're not getting paid. I mean, it's just a real cycle on retention. And so I think we also have to be honest with ourselves about what retention strategies are going to be able to be a grant funded program that don't overall involves. I mean, that doesn't mean there won't be any. I just think that we also have to not have unrealistic goals of what these grants can achieve, especially when I think employers are not the people who are receiving the grants. So that's.
I appreciate that, Melissa, because we had a lengthy discussion about that exact thing at our work group meeting. So yellow card.
So my apprehension is still around this RFA for number one. And obviously representing long-term care, I'm super excited to have something that is specifically around CNAs and MAs and LPNs and RNs. I think my hang up is still around the criteria that is prioritizing programs that are already established and ready to scale. And it kind of goes to, I can't remember who it was that was saying, if we're only prioritizing programs that are already in place and potentially have already had the infrastructure funding on grant 1 or grant 2 or some of those others, I think that especially in these healthcare career pathways, rural populations are so underserved that the implementation of a new program in a rural area that is underserved, at least from how I read this, would not be accepted because the HEC is going to prioritize programs that are already established and ready to scale. So I have a little pause and maybe would like to see some type of a bullet point in there that offers the opportunity for a underserved geographic location or like something that targets an underserved population. And yes, I know that that's part of the priority populations in the criteria to begin with. But I also worry that if we're only prioritizing programs that are already established and ready to scale, does that inadvertently give us a direct pathway to, I think, what Heather was talking about around the grant hopping? And now you've got programs that are already established out there that may have gotten funding from grant 1, grant 2, now going into grant 3. And how sustainable is that if they're consistently getting the same type of funding for the same type of a program? Does that inhibit somebody from being innovative in a rural environment or in programs where it might be needed more?
So I want to respond because when we had the scale conversation, it did not mean you had to already receive Future Ready Oregon money. So I just want to clarify. And I'm saying like infrastructure could mean a community college that already has that infrastructure. I just think what I understood the conversation to be around scale was that it was, so in say a rural community that doesn't have an established community-based organization, that doesn't mean their community college that has infrastructure to launch a nursing program couldn't apply in that. It was more building a program entirely from scratch and building the infrastructure entirely from scratch. And this didn't make sense with the time horizon, especially as we considered sustainability. So it was more infrastructure that was already established, not necessarily, and so I'm hearing maybe the suggestion is to clarify scare. Yeah. Yeah, go ahead.
Oh, I can't talk about the mic. I want to say, it's really difficult because money's limited. And that's the hard part, because I think everything you talked about is wonderful, but given the amount of money that's limited, what do we do with that? And that was hard as a group to really come into consensus in terms of deciding the focus. So I think that was the biggest challenge. Wish we had more money, but.
We do not. Oh, yep.
I don't know if there was any more yellow cards, but I did feel like, I was kind of tracking the conversation, and it feels like the two things that really raised to the surface about potential like additions to the criteria were making sure that we were calling out retention and also sustainability. And I don't know if that's a proposal that needs to go in terms of like then moving to the next phase.
Yeah, well, I have to go through all the yellow cards for, no, not. We have one more yellow card. You're fine. You have it can make a comment. Yes. And then we'll get to the final yellow card, but those were two things we captured, and I captured clarification on scale as the third.
Yeah, I just wanted to say how much I appreciate this conversation. It really resonates with conversations that are happening in the Oregon Health Authority through the Healthcare Workforce Committee in follow-up to the Healthcare Workforce Needs Assessment that was done last year. And I believe at the first meeting, my colleague Krista Mars presented on that. We've kind of developed this strategic framework that has 3 priority areas around wellness and resiliency of the workforce, and then also development and retention, and of course, increasing diversity. So just, want to kind of reiterate hearing this in multiple spaces, and also to point out the wonderful report that Oregon Center for Nursing did related to House Bill, I think it was 4003 with UCSF, that is sort of parallel to the report that came out of the HEC.
I appreciate that. And I appreciate some of the systems alignment issues you're calling out, Neelam. So Becca, you have a yellow card. You have a microphone here.
Most of my comments have actually already come up through others, but I just wanted to also clarify I think people looking at the second application might be a little confused on what regionally identified workforce needs mean. So just emphasizing, I think sharing with the report and kind of some of the findings to date will be really helpful for people, and saying like, yes, I can opt in, rather than like, I don't know what that is, so I'm just going to sit out. Just emphasizing, I think, the need for some of that for somebody looking into this.
So I'm hearing that recommendation is like a clarifying maybe question in the application that is, or in the RFA that clearly identifies what a regional workforce need is.
Right. And just kind of pointing to like this data can be, and not like this only is, kind of framing. Yeah.
Okay. Thank you. Oh, one more. I'm getting a run-in.
Just a clarifying question, and local communities can identify what regional means to them.
Yeah, we don't identify what community is and what regions are. Okay.
I mean, I think the idea was that we had this like clear statewide data on the nursing workforce and nursing related professions. And it wasn't, and on the regional partnerships, I think it may not be explicitly stated, maybe we could explicitly state it, that a local region, whether and defined how the community or region chooses to define itself, would bring forward data from their community about what the need is. So it's not that there would be no data, it's that they are, I mean, if you're going to apply, you need to understand your own data and present the need. And that based on that need, that would be part of the criteria for the project. And so I think they're both data driven. They're just data driven in different ways.
Just one more comment on that. And part of our discussions with the RGC is basically data collection. Sometimes people that are vulnerable, that are BIPOC or other communities in rural, they're invisible. And data is not collected really well on those people. And that's why the community needs to dictate what their needs are based upon what they see in their communities, which is really important. Thank you.
Yeah, and Christina is joining, I think, on Zoom if she's not already on, and she was on our funding working group and talked a lot about historically erased communities and that's where I think we really felt that the community needed to identify that. I'm excited everyone's talking about data because in our medium-term objectives, we'll be doing that.
I'm green, but just a quick clarifying question that I think helped me on the second proposal. We had that excellent presentation from Dave Kohler about Rogue's program that was community-based on a community needs assessment. That's what we're talking about, right? Fantastic.
And Dave was on our funding working group and is getting accredited today, so could not be here. Okay, Turner, I think we have heard the yellow cards and have started to capture.
And so what I was trying that actually amount to changes in the way the RFAs are articulated or specifics about how they're articulated. One would be referencing the report that Duncan referred to about needs. Include the retention concept explicitly, and this is in number one, RFA number one, and define that in the ways that you all described. Let's see, include this concept of sustainability as part of the criteria for, I think, well, number two in particular, but probably applies to number one as well. And then inform with data. So I think that was already kind of answered that data is going to inform both number one, where it was explicitly referenced, but also number two, as was just discussed. Clarify scalability. That was the other one that I heard towards the end, is kind of understand what that means. And not so as not to exclude things that local needs in particular, which was where that last conversation was just going. And then clarify, right, what regional workforce needs means and how that gets defined, or how communities can bring that to bear. That's what I got.
Did we miss anything?
All right. Okay. That's encouraging. All right, let's try our cards one more time here. And no shame if people still have more to discuss. All right, going around the room. I see greens. Oh, green. It's green all the way around the room. Woohoo!
So before we actually do that formally. I'm going to give everyone a break. And the formal process will happen at 11 o'clock. So we have until 11 o'clock. There's food. And just be back in your seats because we have, I think, some folks that are going to participate on Zoom at 11 o'clock. Thank you. All right, folks, we need to move to our action item. So if you are a voting member of the consortium, there will be time for networking after. Thank you. Thank you. Okay, I am going to hand this over to Dr. Bennings, who's going to lead us through our action item.
All right. So for this action item, I'd like to express that we as the executive leadership team have experienced the process of with consensus. And at this time, I do want to put an action item out there. Does anyone oppose or abstain? Noting that we had the consensus process with the documented recommendations and feedback. Does anyone oppose or abstain at this time? And I'll give a moment for in the room, but also online. Okay, seeing no opposition or anyone abstaining, I propose that we move the recommendations forward.
Can someone, you motioned it, can someone thumbs up? And we document that we have motioned and moved the recommendations forward. Well, congratulations, consortium members. We did something together that was pretty monumental. And we're starting to practice rolling up our sleeves and getting some things done. So if I forced you into a seat too early, I'm sorry. You can go up now and get some more food before our lunch presentation. That was a time sensitive agenda item, but it is my pleasure. Many of you highlighted the need to look at data, to look at evaluation of the Future Ready Oregon program. So thought that this would be a great opportunity to bring the Higher Education Coordinating Commission's Research and Data Director, Amy Cox, who led the Year 2 Future Ready Oregon report, to present on these findings, and Jennifer Purcell, who will go into a little more detail on the healthcare grants. So welcome, Amy and Jennifer.
Thank you. All right. Well, first, congratulations to all of you. Thank you to the funding working group members. Thank you to the executive leadership team. Thank you to Sarah, and thank you to Turner, and thank you to everyone for participating in that process. It's really exciting to have reached this first milestone together. As Sarah mentioned, I'm going to just do a quick introduction and then turn the microphone over to my colleague, Amy Cox, the director of our Office of Research and Data, to walk you through the initial findings of the Future Ready Oregon second annual report. Next slide, I think, or previous slide. Nope, that's me. Okay. Great. So we're going to talk a little bit about lessons learned from the implementation of Future Ready Oregon that really is intended to inform future workforce investments. Some of that is reflected in the themes of your conversation this morning. And then Amy will talk about the highlights of the report. And then we'll provide some updates on the most recent round of Workforce Ready grant investments, specifically those that are advancing innovation and equity in healthcare workforce programs. First, as a reminder, Future Ready Oregon is a $200 million package of investments that work together to advance a more equitable workforce system, growing diversity in our workforce, and increasing equitable prosperity and upward mobility through grant making and strategic initiatives. And really, what I want to focus on here are the 4 pillars of the work that we're doing. And I mentioned a little bit of this earlier, but the work of Future Ready Oregon is centering the needs of historically underserved and underrepresented communities. In Senate Bill 1545, those communities are identified specifically as priority populations. We are also prioritizing key sectors of our economy as are reflected in our industry consortia, of course, healthcare, and then manufacturing and technology. We're advancing innovation and flexibility in workforce investments, specifically by coupling education and training and wraparound supports and services, and then advancing this shared leadership model and through partnerships in our grant making and the way that you all are working together and co-creating solutions. Future Ready Oregon is really foundationally believes that when we engage education and training partners, industry leaders, labor leadership, and culturally specific community-based organizations, that we are informing workforce and talent development more holistically. Of course, the Future Ready Oregon suite of investments, as you all know, included general fund and federal ARPA funding, and was distinctively designed to leverage both existing successful programs and invest in new and innovative approaches. And as I mentioned, innovation really rooted in these 4 principles. In the short term, the general fund investments were designed to advance and leverage existing programs and partnerships, really focused on expanding capacity to serve priority populations. And in the longer term, we're now shifting our strategy to the ARPA investments that are advancing new and innovative approaches that require a bit more time, which the ARPA funding, although 2 years doesn't seem like more time, it's more time than we had in the implementation of the general fund investments, to really build partnerships and infrastructure. We're beginning that work now, and I'll be introducing specifically some of the most recent healthcare related investments and initiatives in a bit. But first, I want to turn it over to Amy to walk you through HEC's Future Ready Oregon annual report that was delivered to the governor's office and the legislature December 31st. Amy.
Thank you, Jennifer. Good morning. My name is, I'm going to move this back actually and just talk to you for a second before presenting to you. My name is Amy Cox. As you've heard, I'm the director of the Office of Research and Data, which is a different part of the HEC. It has been our office's task to take on the multi-year review of the Future Ready Oregon investments. And while I am the one in front of you, this is really the work of 6 different people in our office. So in some ways, I am just a figurehead of a team that's really done a great job working all year and last year on trying to capture the work of the Future Ready Oregon programs and also capture some data on the participants and those programs to present this to you. Before moving forward, I do want to also say it is just a real pleasure for me personally to be here this morning, not only to present this report that we worked hard on, but also because I am the daughter and granddaughter of hospital nurses. And it has been really gratifying to hear the conversation this morning. So thank you so much for the work that you're doing. It is really important. Now I'll move forward. And because I haven't presented to this group before, I wanted to orient you to how our office is approaching this multi-year review of Future Ready Oregon. And it is really with these 2 intertwined questions. Number 1, does Future Ready Oregon lead to greater economic security? That's greater economic security for individuals, the participants in programs, for communities, those that they represent, and where programs are located, for businesses who are seeking to fill labor shortages, for whole industry sectors, including, of course, healthcare, and for the state as a whole. And also, does Future Ready Oregon improve equity, leading with racial equity? That is equity across workforce training development programs, across employment, industries, and career advancement. And I want to emphasize that we really view these two questions as intertwined. They are not consecutive, because economic security without equity is not sustainable, and equity without economic security is not sustainable either. We take these questions and then we specify them in a whole 1,000 points of light to look at access. That's access for organizations and access for individuals, for especially those, both the organizations and the individuals who are identifying with the priority populations in the statute. We're looking at the practice of implementing the programs. Are they being aligned? Are they implemented in ways that are aligned with the goals of the statute? Are they implemented in ways that are practicing continuous learning? And things like that. And then the outcomes. What are the economic and the equity outcomes, again, for individuals, for industries, for businesses, for the state? In this year's report, I know that's small. This year's report is long. I'm going to warn you now. It's over 150 pages. And that is not because we were keen on writing 150 pages, but because it's really in some ways 8 reports because of the multifaceted nature of Future Ready Oregon. And it looks at a few different things. It looks at the continued implementation of the Future Ready Oregon programs, continuing from last year. This is really important. Everyone I know is eager and hungry to get to the outcomes, and we are also, and we'll talk about that. Some of those take years to evolve, right? As people move into employment and move and stay in employment or don't, retention that was talked about. And the implementation piece is the critical groundwork for understanding all of those outcomes. So if we get to a point at the end of the whole investment, planning and outcomes are a particular way, if we don't understand how those programs were implemented, we're going to attribute the wrong reasons to those outcomes, right? So it's like the example that I gave the legislature was, if you distribute a new medicine in a community, but you don't look at implementation, if the medicine didn't have the expected effects, you're going to assume the medicine was the wrong treatment, but it could be that it was implemented in the wrong ways. So that's a really important part of a multi-year evaluation. It documents these activities so we can look back in future years. We're looking at, in that implementation, as I said in the last slide, we're looking at how those programs have been put into practice, how they've been stood up, not just in the obvious ways like, did they spend the money in time? Although we do look at that, but also in terms of really laying a foundation for creating a workforce development system that is doing things differently. We also look at initial outcomes, the number of participants who have been served, including by priority population and by program, the number of, the rate of completing services for those participants. We look at economic trends for the state in labor force participation, unemployment, industry and occupational projections, especially for particular industries, healthcare, manufacturing, and technology. And we compare those economic trends to the composition of Future Ready Oregon participants. Are these programs drawing in people who are underrepresented in the labor force in the ways that we're hoping? The data sources that we use for this year's report and for all of the reports are are many, many. They include participant data and service level data that the programs have collected, and we have guided them in that collection, economic data from the federal government and the Oregon Employment Department, and qualitative data around the implementation. We pay particular attention, of course, to the 10 priority populations laid out in the statute, which are listed here. As I said, the report is extensive, and so this is really a 60,000-foot level highlight of some summary of the findings. But I think some really important things are captured here and on the next slide. This is the dates here are kind of important, right? Because so many programs were being stood up in such a rapid fire time. It took time really to even begin to serve participants. But simply between May 2022, when the first Prosperity 10,000 grants were signed, and June 30th, 2023, over 9,000 participants were served. That is possible because of the ways that Future Ready Oregon was designed, that those early programs, Prosperity 10,000, Career Pathways, built on existing infrastructure, and was able to expand it, and in ways in particular that would serve priority populations more. And this is quite a feat, I would say. I have been asked, well, is that good? How do you know if that's good? Well, there's not a clear comparison. There isn't a Future Ready Tennessee, for example, right? But I will say, and detail this a little bit more on the next slide, that this is quite strong, I think, and for two reasons. One, because the Prosperity 10,000 total alone is further than it would be given the time allowed, right? So they have Prosperity 10,000 has essentially until 2026 to reach 10,000 participants, their goal, but they've gotten almost 40% of the way there in 25% of the time. The other reason it is strong, I would argue is strong, that's not a quantifiable term, but is because many of the programs in these this first year plus of the investment are focused on infrastructure. And we're not actually even intending to serve participants, right? And so the participants, those programs will be reaching, the extent of the reach of those programs will really be coming in the coming years. I was going to say, next, 92% of participants who shared information about their own identity were from priority populations. This is an extraordinarily high number. I want to point out, it does not include the participants who did not share their identity. And that's intended here. Typically in our office, we present the data on sort of not reported. In this case, this data collection was brand new and challenging for a lot of participants. And we worked very hard in our office to put together trauma-informed data collection materials, to train community-based organizations and other existing organizations in using those materials. And as we did that and gave them that guidance, we got to see the extent of data really increase, right? And the number of participants sharing their personal information and the number of grantees being more comfortable asking. So let's see, completion rate, 97% overall completion rate. So participants who engaged in workforce training services, almost every single one of them completed those. And if you read the report, you will see that many grantees attributed the success, that high completion rate, to the ability to provide wraparound support services, which are not always possible with many workforce development funding streams. We heard this over and over and over. Let's let's see, 31% of participants used those wraparound support services. So not all did, obviously, but for those who did, it was a critical piece, right? To be able to have somebody else pay for the bus pass to get to the training. And then lastly, participants, and this is really key, participants were more diverse in these, even in just these first 13 months that we have data for, participants were more diverse than the labor force. So we have a labor force in Oregon and nationally that is diverse, but not diverse in the same way that the population is, right? So what we see here, and this is part of course, the reason for the 10 priority populations. And what we found is that in the ways that we could compare, which are not across all 10, the employment department collects and releases data on employment rates by race, by gender, by region, by age. And so for those 4 groups, characteristics we compared, and we saw participants being more diverse, participants in workforce programs funded by Future Ready Oregon being more diverse than the labor force in Oregon. I want to speak a little more specifically to the different components, the different arms of the investment. Prosperity 10,000, I've already referenced this. Almost 40% of the way to its goal in about 25% of the time. You will hear these same sort of high 90s numbers a lot in the next few moments and that is in and of itself a finding, right? We saw high levels of serving priority populations and high levels of completion across all of the funding arms that served participants. Prosperity 10,000 served more than 3,800 participants, 94% of whom identified with a priority population, and 95% of whom completed the programs that they enrolled in. Post-secondary career pathways at the community colleges, including right here, served more than 3,300 participants, at least 96% of whom were from a priority population. I want to point out that many post-secondary career pathways grants were aimed at infrastructure, right? And so those are grants that will continue to invest in those programs for years. They purchased CTE equipment, so it would be up to date with industry standards. They created a lot of outreach planning and programming to reach priority populations in a variety of different ways. They expanded infrastructure in terms of staffing. Registered apprenticeships. This program is administered through the Bureau of Labor and Industries that oversees apprenticeship programs and pre-apprenticeship programs in the state. Those programs also, some of them infrastructure in a way because they were about developing an apprenticeship before even rolling it out to serve participants. Also important to note here is that the apprenticeship approval timeline is long. It's like 10 months on average. Okay, there's not a lot of time before general fund dollars are over. And yet, they still managed to serve 300 participants, 86% of whom identified with a priority population. Many apprenticeship programs are in the construction fields. The grants for rounds 1 through 3, they have had 4 rounds of grants at BOLI for 1 through 3. Round 4 was still in the field. 28 of the grants were related to construction, 12 related to manufacturing, and 9 related to healthcare. Although some of the healthcare programs received a higher portion of dollars. That was interesting. Youth programs, these are administered through Youth Development Oregon, which is a branch of the Oregon Department of Education, our sister K-12 agency, focused really on youth who are disengaged from education and the labor force. Those programs served more than 1,000 participants, 93% of whom identified with a priority population. We heard lots of work there, in particular around wraparound support services and the importance of them for those youth. Credit for prior learning. These were not participant serving grants. These were grants open to any community college or public university in the state to advance the assessment and access of credit for prior learning, which is to receive college credit for work, especially like on the job training, military work, things, or credit obtained in other countries that didn't transfer to the United States. 19 of the 25, including OHSU, had access. That's why it's 25. 19 of the 25 colleges and universities applied, and they were all awarded those grants to expand their CPL work. Workforce Ready grants, you're going to hear a lot about and have heard more about, so I'm not going to speak as much about them, but even in that tight timeline of general fund dollars, and even with many grants focused again on infrastructure expansion, still those round one Workforce Ready grants served 868 participants, 93% of whom identified with a priority population. And then, of course, the industry consortia. You all are very aware of the work you've been doing, so I'm not going to detail that. But lastly, the workforce benefits navigators, the eighth component of Future Ready Oregon, is to place a benefits navigator at in each excuse me, of the local workforce development regions. And that work is well underway. They're pilot programs, and they are standing up in different ways in the different regions. Okay. I wanted to sort of make that wide array of programs come alive a little bit in terms of healthcare, because I know this is kind of a laundry list, and some of you may be thinking, but we're just industry consortia. I'm not thinking about those other things. But they're all really related to healthcare, all of them in different ways. We saw healthcare among grantees across all of the funding arms that fund grants. We saw healthcare occupation training very evident across Prosperity 10,000, post-secondary career pathways, registered apprenticeships, youth programs, and workforce ready grants. Of course, there were other training programs too, but there wasn't a place where healthcare wasn't evident somewhere, usually in multiple ways and places. In terms of participants, we don't see it quite as evident. And I imagine that is probably because of the timeline we're talking about. Time will tell if my hypothesis is right. But the first thing is that we need to get participants enrolled. First, we need to stand up programs, right? And that in and of itself can take a year. Then we need to, depending on the program, then we need to enroll participants in programs. Sometimes those participants are ready for career training services and job-specific training, and sometimes they are not. Sometimes other training, career coaching happens first, and then there's job-specific occupation training. So there's consecutive pieces here, both from a program standpoint and from an individual standpoint. And here what we saw is that among the 9,400 participants served, about half of them were enrolled in topic-based job training. Nearly all of that was post-secondary career pathways, which is by definition topic-based job training, right? So the post-secondary career pathways participants sort of in and of themselves are the bulk of that. If we set them aside for the moment, what we saw is 533 Future Ready Oregon participants enrolled in training related to a healthcare industry. And so it's the beginning, but it's much smaller than the 6,000-ish who are outside of post-secondary career pathways. It's about 5,800. Duncan, do you have a question? That I can't answer for you yet, but I'm happy to come back and tell you. We were still pulling those data in from the community colleges to be able to track that out. No other questions. Okay. I want to conclude with 4 sort of overall across all of these different arms, 4 overall themes that we continued to find in both the quantitative and qualitative data. And the recommendations really that follow them. The first is we found consistent and repeated evidence that engaging those served, not just sending a mailer, not just outreach, but engaging those served is associated with improved outcomes. I cannot tell you cause and effect yet. I am that person, right? But I can tell you associated. And this includes engagement at all levels, engagement with participant communities, engagement with priority populations on campus, off campus, engagement with applicants and grantees. We heard repeatedly across the different programs how the agencies tasked with administering the programs were doing things differently than they typically did with a government RFA to bring more organizations to the government funding table, if you will, than typically apply. In particular, organizations representing priority populations. And then we heard that more of them did apply than typical. We also saw engagement across those agencies, with each other, with partners outside of government in order to implement the programs in the ways that are inconsistent with the statute. I cannot tell you that is exactly why we see the high level of identification with priority populations among participants, but I certainly believe that it probably is part of it. Time will tell as data continue to come in, we'll be able to make that association, that relationship link tighter. But in this first year and a half of Future Ready Oregon, it's a pretty strong finding. The recommendation that follows is quite clearly future workforce development investments, especially those that aim to advance equity, should prioritize engagement with the communities intended to benefit from the investment. And current investments, i.e. Future Ready Oregon, should continue to do so. This may sound obvious to you. It is not always the practice. Finding number 2, one of the most commonly reported benefits of Future Ready Oregon for the grantees, the organizations receiving the money, was the flexibility of funding. Grantees repeatedly described the ability to provide wraparound supports as a significant reason they were able to serve as many participants as they did, especially from priority populations. Again, that may not be surprising to you, but it is not something that is typically funded in government-funded workforce development funding streams. Government-sponsored, I should say, workforce development funding streams. And the recommendation that follows, future workforce development investments should include flexibility for allowable use of funds to encourage innovation, maximize reach, and improve program success. Current investments should continue to do so. So the program success that we saw, the completion rate, which does not include completion of wraparound support services, by the way, it's completion of career coaching, job training, that kind of thing. It's independent of the wraparound support services, but that completion rate, as high as it was, really facilitated by those wraparound support services. So the idea that we want to provide job training for people, but not provide them the ability to complete the job training confounds a whole program success. And what we heard here repeatedly was that barrier was removed. Finding number 3, topic-focused job training, especially in healthcare, manufacturing, and technology industry sectors, is not common among participants, perhaps not yet common among participants, but isn't at this point. Only 29% of participants outside of career pathways enrolled in any topic-focused training, and less than half of these were in those 3 key industry sectors. The recommendation that follows, Future Ready Oregon programs should expand workforce development trainings for the healthcare, manufacturing, and technology sectors. I spoke about that a bit, so I'm not going to go in further on that. And then lastly, administrative burden can be high, especially in rapid, multifaceted programs like Future Ready Oregon. And even for one particular grantee in one particular arm of Future Ready Oregon, it's still multifaceted because in a funding way, in a financial way, because it involves funding that's general funds and funding that's ARPA funds, and those have different administrative requirements. So the support that grantees received from agencies in the application, the awarding, and the reporting, I don't mean the report that I'm telling you, but the reports they have to return to get the money, and reporting processes eased this administrative burden and improved efficiency and accuracy. So those reporting obligations for grantees can be significant. They are significant for the ARPA dollars. And though they're underway now, that portion is underway now for grantees, is not only time consuming just to complete, but also to learn. And what we heard was the work that many agencies did, the HEC, BOLI, and YDO at ODE, that many agencies did independently and with each other, collaborated with each other to roll out, to do the learning for the grantees essentially, and then roll out the training to sort of get them a leg up. You know, obviously grantees have to do their own reporting of the requirements for the funding, but to make that much more possible, freed grantees up quite a bit. And future workforce development investments should provide the time and staffing resources to plan how to build processes and tools that ease the administrative burden on grantees for different funding sources. Current investments should continue to do so. Again, maybe that sounds obvious, but I will tell you it is possible because the Future Ready Oregon investment funded the positions that were able to do that. So, I mean, I work in state government and we don't always have people to do the work that we're mandated to do, even though we're mandated to do it. So the fact that the investment funded positions to be able to be dedicated to career pathways, dedicated to workforce ready grants, dedicated to Prosperity 10,000 enabled some of that administrative burden to get resolved. So again, not always the way it works, and evidence of doing things differently. That's the end of my slides. I want to see if there are questions before turning it back to Jennifer. Yes.
I'm going to make you repeat that question. So folks online, if they're paying attention to closed captioning, you don't get it.
So does the report include stories of people that went through the training, went through the support, went through the process, and how that transformed their lives? So for example, we were at a committee meeting with the Labor and Economic Committee, and I shared a story about how a dishwasher became an EMT because of the Future Ready Oregon program. That was powerful. So for the politician, for like the leader, he said, Martin, that's what we want to hear. How can you transform somebody from a dishwasher to an EMT, professional career, benefits and everything, career development? I mean, that was powerful. So I'm hoping that report captures a lot of that stories from people.
That is powerful, and stories like that are powerful. I could not agree more. And yes, the report does include stories for each of the funding arms, and we will continue to provide those in upcoming reports as well, because both my professional and personal belief is that the evaluation is stronger when we can include both quantitative and qualitative data. The qualitative data illustrate in a way that quantitative data don't. Yes, for sure. Duncan, any questions?
I think we have questions at the end, but Duncan has maybe a clarifying.
One question on the folks who were not in one of the three sectors. What examples? Where would they be going? What training did they receive?
Oh, that's a great question. They varied widely, but some of what we heard, for example, in the youth programs, we heard about lifeguard trainings. There's a huge lifeguard shortage. I'm not sure if people are aware of that, but there's a huge lifeguard shortage. And youth are keenly associated with lifeguard occupations. But what that does is it sort of gets them in re-engaged These are disengaged youth. So that's one that comes to mind. Construction, right? Yes, definitely construction.
We're going to have a lot of question time at the end, is it clarifying? Okay. I just want to make sure that we have
Yes.
quite a bit of time for
don't lose track
discussion.
of the question though. If you're like me, write it down.
Yeah.
Excellent. All right. So I am going to build on what Amy shared from the year 2 report and sort of bring us a little bit deeper into the healthcare investments. I'm going to provide you both an overview of the round 2 investments in healthcare workforce programs and talk to you a little bit more about what we've learned through our grant making processes. All right. See how the map turned out. Okay. And it was noted for me that the slides did not make it into your packets, but we will make sure that you all have a copy of the slides in follow-up. The colors are a little bit different than what we have in front of us. So we'll make sure those are corrected when we get that to you. So this map includes the projects that are being funded in that second round of Workforce Ready grants that I think we talked about at your last meeting at a super high level in terms of the overview, but this gives you a little bit of a deeper dive into those projects that are funded specifically in healthcare, and then some projects that cover multiple sectors between healthcare, manufacturing, and technology, but include healthcare. As a reminder, the round 1 investments focused largely on capacity building, where the round 2 investments are really specifically focused on serving participants and advancing occupational training in those 3 fields: healthcare, manufacturing, and technology. So we funded 12 healthcare specific proposals that totaled just over $15 million in this round. Some proposals received partial awards based on applications and overall demand. I think we shared with you last time, we received over $250 million in requests for funding and had roughly $35 million available. These program awards ranged from $400,000 to $3 million and advance innovation in a variety of disciplines, including dental health, doula training, community health workers, emergency medical technicians, behavioral health, community health, and dental health aides, nursing pathways, RNs, CNAs, and phlebotomy techs and medical techs. So very diverse across the healthcare landscape, and part of, as Sarah mentioned earlier, informing what might become more focused in the sector specific rounds. Let's see, I want to call out a couple of projects to highlight for you, and you may not be able to see those from where you're sitting, so I will do my best to share the content with you. So breadth of programs, as I mentioned, across disciplines, but also different approaches to partnerships and program implementation. I'm going to highlight a few projects specifically. Mercy Flights is a program that was designed in the first round of Workforce Ready grant funding. It's intended to inspire future generations to pursue EMT and paramedic degrees, and supports participants during their EMT and paramedic degree training program, and is an earn and learn model. The Mercy Flights program is on the South Coast. I'm my subject matter expert. South Coast. Yes, South Coast. And really is an example of building on the capacity building investment with a new and innovative approach to meeting community specific workforce needs. The second example I want to draw your attention to is an award to the Northwest Portland Area Indian Health Board. This round 2 investment is for the initial design, development, and program launch. It is designing and implementing culturally specific program for American Indians and Alaska Natives to pursue certification in behavioral health, community health, and dental health programs. The Northwest Portland Area Indian Health Board, again, is an example of beginning the development across multiple disciplines within the healthcare sector. And then Rogue Community College, who I believe you heard from at your last meeting. Rogue Community College received an award. The program was designed prior to the round 2 grant investment, but these funds will allow Rogue to expand their Associate of Applied Science Nursing program through simulation education, obtaining program accreditation to expand their clinical sites, and adopt an innovative joint partnership with local hospitals for nursing staff. So I think you heard a little bit more about the faculty retention piece in Dave's presentation. Again, this is an example that's addressing barriers to program implementation and expansion at a community college. Mercy Flights and Rogue are examples of regionally focused projects that are single discipline and engaging multiple priority populations and advancing partnerships, where the Northwest Portland Area Indian Health Board is an example of a multidisciplinary program, but for a specific population. It's important to point out that there's no one right answer. Part of what we're learning through the Future Ready Oregon investments, which I've heard from all of you is really important to hear what we're learning, is that there's not one model or one program that fits all. And it really is the flexibility of these funds that is allowing us to learn more about what partnerships, what supports, what program structures, what tools and strategies are most effective in advancing a diverse workforce. Some themes that we know for sure is that the flexibility of the funds and the partnerships are critical to the development and expansion of programs that meet industry needs and the needs of participants. And the hands-on training and wraparound supports are really crucial to the participant successes. And to just, where am I pointing? Can you advance one? Thank you. There we go. To just summarize that more specifically, as we're administering grants and the strategic initiatives in Future Ready Oregon, we're learning from our partners, engaging in continuous improvement in our processes. And over the first year and a half of implementation, some really clear themes have emerged. And you heard this from Amy in the year 2 report. And you can see this in some of the grant funding, but specifically, the flexibility of the Future Ready Oregon investments is unique. It centers the needs of community-based organizations and their community members as equal partners in the workforce system and central to the co-creation of workforce solutions. The flexibility of funding allows for capacity building and wraparound supports to be allowable expenses in a way that other funding sources don't allow. And it gives us as administrators the flexibility to be agile and responsive, to listen to partners, to listen to feedback from participants, and to really respond and pivot in ways that are meaningful both to the partner organizations and the individuals they serve. The second theme, which I think you heard from Amy as well, is it really is the success of the administration of these funds is centered in the individualized supports, the high-touch technical assistance that we're providing, the grant-making processes themselves have been intentionally designed to be inclusive and low barrier. We're providing technical assistance providers that have been contracted to support prospective applicants throughout the grant making process. I think somebody mentioned earlier around equity concerns for larger organizations that have that grant writing capacity. We have technical assistance providers under contract to support applicants with their application throughout the process. We're providing feedback to applicants that were not successful in their funding application, and we're building communities of practice and providing ongoing direct support to grantees. We're also centering partnerships. We've talked a lot about this. It's central to the work of the industry consortia, but I think it's really important to emphasize, uniquely to Future Ready Oregon, we're bringing together a table that includes community-based partners, industry leaders and employers, education and training providers, labor organizations, to co-create solutions that support equitable opportunities for economic mobility, educational attainment, achieving meaningful employment, and career advancement. And with that, I think that brings us to the end of our slides. And Amy and I are happy to answer questions about the first year and a half of implementation and how that has brought us to some of the decision-making that you all have reached today that moves us into the next phase. Your turn.
Heather, the first opportunity, because she had the question.
I'm so excited. I'm first question. So I really appreciate that. Thank you so much for your presentation, and really appreciate the technical assistance and support for folks, and also the flexibility of the funds. It's really nice to have for grantees, and having worked in nonprofit sector and government sector my entire career, it's really nice to not have such tight guidance that you have to spend the fifth nickel on the third Tuesday on the fifth item on your 17th page of your ledger sheet. Thank you. Really appreciate that. Because it helps us help people and to build our community workforce. I guess I had a bigger question. I have my data geek hat on, and I'm wondering, is there an opportunity in the data because it looks like some workforce systems, or I don't even know what the right words, because I'm not a workforce professional, but some systems that are engaging and then moving people through the process to permanent employment, whatever that workforce term is, I don't know it. But some of them are more mature and really moving people more quickly. And then is there a way to kind of look at how is that happening, and why are those grantees so successful in moving so many people? And could we apply those lessons learned from those grantees to sectors that are underdeveloped, like behavioral health, where we have really underdeveloped partnerships and awareness and systems in place to move people?
Thanks so much. Okay. You said data geek, so I looked straight over to Amy and summoned her to join me, and I'll let her talk a little bit about employment data, pathways to employment, and how we can quantify that. I also I don't want to miss the opportunity to speak to your comments about the flexibility of the funding, because we hear this over and over again from grantees that they are not included as full partners in this grant making process, and the flexibility of these funds being unique has really allowed us the opportunity to be responsive to our grantees as full partners. You know your communities, you know your the landscape of workforce need. You see on the ground where those barriers, gaps, and opportunities are. But really, it comes back to the flexibility of these funds that was built into Senate Bill 1545 that allows us to be flexible and responsive. So I just didn't want to miss that opportunity. And then on employment data, pathways to employment, how we quantify sort of what's successful. I'm going to let Amy talk a little bit about that.
So I want to repeat back your question, make sure I understood you properly. So if I understood you properly, you're asking how, is there a way to assess whether some programs are able to serve participants sort of more quickly, or more, a higher percentage of their participants? And if so, can we glean those lessons learned and share them? The answer to that is certainly yes. And coming, right? So it takes time for, as I said, programs to be stood up, participants to be enrolled, participants to get training, participants to get employment, participants to stay in employment. And it takes time for collecting and cleaning and validating and lots and lots and lots and lots and lots of backroom work to report them, right? So that's true at the employment department and in our shop as well. Employers share wage data to the employment department, and it's usually around 6 to 9 months at least before we really actually start looking at the employment wage data, because they're sort of solid and ready. And as we go forward, what we will be doing is matching to those wage records that's sort of next in our queue for the participants we have, and seeing who got employed, what were their earnings, and we'll look at multiple different comparison groups. We'll see, well, how about for participants who weren't employed prior? Are they employed now? How about participants who were employed? Are they employed at a higher wage? Are they employed? How about for participants who went to a particular job focused training? Are they employed in an industry that's related? We don't know occupation. We just don't have it, but we have industry. And so we'll look at that. And then we'll start to assess, after all of that, time and pace. Yes.
I guess my follow-up question is that's really great. Individual participant and data. I guess just to clarify, I was thinking more along process study. If there was questions set up from the beginning that would allow you to do implementation process evaluation on recommendation of operational procedures that were more successful versus not as successful, regardless of the industry that was being pipelined. Does that make sense what I'm saying?
Yes, it totally makes sense. And the answer to that is yes, at a lower scale. And the reason for that is really that kind of broad scale qualitative work, which I have done and love, is extremely labor intensive. I am not happy to say that to you. I would like to do that broad scale. The number of grantees in Future Ready Oregon just prohibits it to be doing it at that scale. But what we have done is invite them to share their processes, and we will start to link some of that. Link isn't maybe right, but match some of that with what we see in the quantitative data. Sure. Great question.
Marin, do you have a question?
So also in the data, are you looking at how universities or colleges are part of these programs adapting or changing in terms of how they approach training, how they approach learning, how do they approach working with vulnerable students or populations? Are you seeing that, or are you seeing any type of that data?
I'll repeat and
Okay.
start with some preliminary reflections. Yes, is the short answer. The question, as I heard it, was, are we seeing sort of systemic change in
Correct.
how community colleges and universities specifically are approaching how they work with vulnerable populations? I would say in the early investments, we talked about systems change. And Marin, as you're aware, as we were developing Future Ready Oregon, Senate Bill 1545, we really looked at, okay, there's 8 program elements. That was very intentional, because we have the opportunity to drive systems change by investing in community colleges, in credit for prior learning, in our local workforce boards, in our community-based organizations with similar priorities. And what we've seen, community colleges and universities, of course, had access to credit for prior learning investments. The community colleges were eligible for career pathways investments. community colleges and universities eligible for workforce ready grants. And we have seen several institutions that are really embracing centering the needs of priority populations and changing the way that they partner with industry and the way that they partner with community-based organizations, in part because the funding requires it. The question about sustainability of those partnerships, I think, is one that we're all evaluating as we move through the life cycle of the Future Ready Oregon investments. But we are absolutely seeing that, particularly as we evaluated the round 2 funding applications.
So for example, Amy, you mentioned a report that being more engaging and more connecting with people got you better outcomes with a student. And that's really important, because learning education is one component. If people don't feel comfortable, safe in a space of learning, they're not going to learn as much. So that's really important. And I'm glad that you mentioned that in the report. Thank you.
So I would just add to what Jennifer said. It's a really good question. Let me just say that first, and one that's on our mind really in the long term, right? To be looking at this really in the long term. But in these early reports, some of what we've seen at the colleges and universities in particular around career pathways, I don't have the number offhand, but a large portion of those infrastructure grants were focused on outreach to priority populations. Those are investments that I want to not oversell this. So I'll say it and then a caveat. Those are investments that change the way things are happening, right? Because that wasn't happening at all before. It was like, here's post-secondary career pathways. We're going to do sort of broad scale outreach. We're going to really try and get students engaged. We really believe in this. Look, this can help, but to do outreach that's focused on particular communities is not something that it is something we saw happen because of the Future Ready Oregon grants. And that sustains, right? People continue to use those practices after a grant is over. The caveat is that sometimes those activities take staffing that may or may not be there after the grant is over. So that can be challenging. But the cat is out of the bag already, right? Now there's an example, and it's a lot easier to maintain something than it is to develop something and maintain it.
Other questions for Amy or Jennifer? Okay, I'm going to assume that we have no more questions. I want to thank our presenters, Amy and Jennifer. And to reiterate, we will be sending out, I realized that you could not see the detail on the slides, so I apologize. We will be sending out the slide deck so you can look at it in more detail, and also emphasize that this was from the capacity building grants, and there's going to be a lot of data forthcoming, as Amy mentioned, on our round 2 grantees. So I've lost the clicker. So I think we're likely going to wrap up a little early, but wanted to share a little bit of information and just buckets of work that we've been with the executive leadership team thinking about as we move into we're still in quarter 1, but finishing out quarter 1 and quarter 2 of this year. Thanks. First is, as I mentioned before, congratulations for advancing our recommendations with the caveats and the additions that we talked about today. But I think that there's a role for the consortium to promote the RFAs to make sure we have a diverse applicant pool, especially related to some of the projects the types of projects that were elevated today. This will go through the competitive process at the HEC, but making sure that we do have that diverse pool that represents not only industry sectors, but the types of retention projects we elevated today. We anticipate the release I'm going to put this date out there, at the March or April. We're currently contracting with our TA providers that Jennifer mentioned, and do anticipate the release will be in a couple months here. I heard a lot, and this especially, I know you're not going to remember our September meeting, so I'll do a little bit of recap. But as you recall, I did some of the, I shared some of the survey results from the survey, and two things that popped up in that survey from members. One, we did not have a level of industry engagement that we felt like was needed at this table. So, and the second was, how are we building our data systems to do better workforce demand planning? So these two bullets represent that from your survey. The first is better relaunching the conversation around integrating supply and demand data. In particular, the OLDC report did a great job of elevating the nursing pathway and the barriers. They measured demand a certain way. So I think we're going to get into like how you're measuring demand. What does demand look like? And then how can we support the supply side of that conversation with data? So expect to hear more about that bucket of work. The third is intentional engagement with industry partners. How do we integrate the education and training pathway if we don't know what industry needs? So we're going to be doing some focused conversations with industry partners over the coming months, and repurposing some of our work with Oregon Consensus to support those conversations. And then, you know, we heard from Amy, but this table is really thinking about how to inform future investments in healthcare specific workforce and talent development for, in particular, the 25-27 biennium. So this is our work ahead. We started to practice working together I think was a big task to decide how to spend a large portion of our Workforce Ready Grant dollars. So just wanted to first of all, thank the working group members. Many aren't able to be here today, but just thank your leadership for engaging in that process over the Q4 of 2023, for coming, all of you for coming and staying engaged today. I think the more we can keep coming back to these meetings and having deep engagement in our quarterly meetings, but also in our working groups, the better we will be. And I think that's it. I just want to thank all of you for your participation, and we will wrap up early. But before I wrap up, two things. One, thank you, Dr. Bennings, for lunch and for hosting us today. We just so appreciate the space. And the second is Sage is right here and is open to taking people on a tour of the new health sciences health technology facility. So if you're interested, I know I'm going to go. If you're interested in taking a tour with Sage, that is available to you. And so we have extra time to do that. So thank you again. You have my information, so you have any questions, but we will be reporting out with those revised recommendations for all of you and the slide deck and more information in the coming months. Anything from my executive leadership team?
Sorry, making her run one last time. I just wanted to thank Sarah because the work because she's the one keeping us organized, on track, compiling information, making it digestible, and then helping us to reach consensus. So thank you, Sarah.
Thank you for that, Becky. Well, it's been a pleasure. So if y'all want to hang out with Sage over here, but if not, drive safely.